So this study was about role of breast conservation surgery in locally advanced breast cancer. So as we know that in developing country like India, the patients present with the locally advanced breast cancer in majority. So we are not doing a public screening program. So many of our patients present with locally advanced breast cancer, and the role of breast conservation surgery in this group of the patient is really not well established. So that there are many retrospective studies which has published their data, and our study is one of the data analysis of the recent year. So what we have done, we have included patients from 2011 to 2016 treated in our center with neoadjuvant chemotherapy first. These were all locally advanced breast cancer, and we have analyzed the data for the overall survival, disease-free survival, and local recurrence in the two groups. One was the BCS and one is mastectomy. So this was a retrospective study design, as I said before. So this was including all patients treated with curative intent in a single center of locally advanced breast cancer with neoadjuvant chemotherapy followed by surgery. So data were collected based on the hospital management system. It's an electronic system in our center, and the survival data were collected prospectively, and all patients received all cycle of chemotherapy before doing surgery. So we don't practice sandwich chemotherapy as practiced in many centers. So this is a advantage on this study because all chemotherapy cycles were completed before surgery, and it was analyzed with the help of SPSS and Stata software. So what we have done, we have included around 411 patients in this study, after excluding some patients who were not fulfilling the study selection criteria. So out of which in 146 patients, we have done breast conservation surgery, and in 265 patients, we have done mastectomy. So first we compared the two group, BCS and mastectomy. So BCS is breast conservation surgery. So they were found similar apart from the age. So mastectomy patients were a little bit elderly than the breast conservation surgery. They were of higher T stage and N stage, and they were not having PCR as much as in breast conservation surgery. So these were the four differences between the two groups. When we looked upon the outcome data in these two groups, so what we found that the local regional recurrence in the BCS group and mastectomy group was similar. It was 8% in a median follow-up of 64 months, which is around 5 years. So it's a good duration of the follow-up for locally advanced breast cancer. And when we have looked upon the isolated breast recurrence in the BCS group, it was 4.8%. And in the mastectomy group, it was 1.9%, so which was not significantly different statistically. The overall survival and disease-free survival were surprisingly better in breast conservation surgery in univariate analysis. And just like early breast cancer, but when we have adjusted for age, T stage, N stage, and the pathological complete response, the overall survival and disease-free survival were similar between the two groups. So what we concluded that the BCS in selected group of the patient can be offered in locally advanced breast cancer patient having very good chemo response. So in India or in any developing country, in the locally advanced breast cancer is the presentation for 50% of the patient, and now with the add of the quality chemotherapy and target therapy. So at present, in majority of the developing country too, with the patients are receiving both anthracycline and taxane. And this is also one uniqueness of our study that all patients, almost 90% of the patients were receiving taxane. So the dual challenge, the challenging chemotherapy with the dual agent, and many of the patients have received trastuzumab, a target therapy. In our study, we had the limitation that the patients have not received trastuzumab due to cost issue, but nowadays, because the availability of the biosimilar trastuzumab in our country or in many developing country, patients are taking trastuzumab because it's affordable, a little bit affordable, better than before. So with the better chemotherapy and target therapy, patients are having good response or very good response with the chemotherapy, and the breast conservation surgery can be offered in selected group of the patient if they are having good response and if it is a limited disease to a specific quadrant of the breast to start with. So I want to add to the practicing clinician or practicing breast surgeon that if you are offering breast conservation surgery in this particular subgroup, locally advanced breast cancer post chemotherapy, if they're having very good response, be careful in selecting the patient. Try to assess the clinical and radiological response in pre-chemotherapy, during chemotherapy, mid-cycle, and at the end of the chemotherapy, and then offer BCS in selected group of the patient. So it should not be offered to all patients. It should be offered to the selected group of the patient which are having good response to chemo and have limited disease to start with.